Well, hello, everybody. Happy Wednesday. Welcome to Recovery is Health, Health is Recovery Lunch and Learn series. My name is Randy Pedersen. I'm the Syringe Exchange Program Manager at the Idaho Department of Health and Welfare. And I'm excited that you've joined us today. As many of you know, September is National Recovery Month. And this year, partners at the Idaho Department of Health and Welfare, Recovery Idaho, Idaho Harm Reduction Project, and the Northwest ATTC are collaborating to provide a lunch and learn series focused on health topics in recovery. So this is session 5 of a 6-session series where we've discussed topics such as harm reduction, infection prevention, and treatment, and smoking cessation. So we'll go through just a few housekeeping items. I encourage you all to introduce yourself to your peers in the chat to help foster a sense of community. As you have questions, please feel free to add those into the chat or save them for the end of the session. If you would like to ask your questions a little more privately, please know that there is an option to do that within the chat as well. So recording and slides will be available on the Northwest ATTC website shortly after this session. And then you'll also receive a survey requesting feedback and a certificate that can be used to obtain continuing education credits. So today is part 5 in this series, and we'll discuss sexual health and recovery, specifically focusing on certain sexually transmitted infections. Our wonderful speaker is Lindsay Haskell. Lindsay has a master's in health science and has been working in healthcare and public health for almost 2 decades. She is passionate about improving health, especially through prevention and public health interventions. Lindsay has worked in the field as a disease intervention specialist, or a DIS, and epidemiologist, really focused on sexually transmitted infections and HIV in Idaho. Now, I'm excited to say that she is a member of our team at Department of Health and Welfare, and she's striving to share her expertise and build Idaho's DIS workforce. So welcome, Lindsay. I'll hand it over to you.
Thanks, Randy, and thanks, everyone. I'm happy to be here today. I'll get my screen shared and get started in just a moment. All right. And I'm going to stop my video while I'm presenting, but we'll turn it back on during questions at the end. Okay. As Randy mentioned, I'm Lindsay Haskell, and I work with the Idaho Department of Health and Welfare in the HIV, STD, and Hepatitis section. My specific title is DIS Program Specialist, and we will talk more about that later. I'll explain what a DIS is in my presentation. But along with the title of this series, I've titled my presentation Sexual Health is Health. It is part of being healthy, and so adding that into what we'll be talking about today. So today we'll be focused on primarily sexually transmitted infections, or STIs. You may hear me use the term STI or STD interchangeably, and we'll talk about that later, so don't worry. But sexual health is a broad topic, and wanted to focus in specifically in my area of expertise, which is STIs. I also wanted to give a disclaimer about any language and content that might be in here. We're going to be talking about sex and anatomy. It's part of the work we do, and it's part of everyone's lives in one way or another. So there may be some terms, hopefully doesn't make anyone uncomfortable, and no graphic images today. So what is sexual health? Well, it impacts every one of us and our overall health. It's part of our life, therefore it's part of our health and part of our recovery. It's a big part of being human and the relationships we play in our sense of well-being. So it also hits on 2 of the 4 dimensions of recovery, health and community. So when people think of sexual health, sometimes they only think of STIs or pregnancy, unplanned pregnancy, but really it's an umbrella term and is about a person's entire physical and emotional well-being around sex and sexuality. So again, only hitting on part of sexual health today, but it is really important. In case you're still asking why you need to know this, why you'd want to learn about this, or if someone says, I'm not sexually active, why do I need to know this? It really helps with understanding what puts you and your body at risk, talks about your health, identifying healthy decisions, decisions that are right for you or right for others, and a way to support healthy decision making. STIs are common and they're continuing to increase. Many studies have shown an increased risk and infection rate among individuals using or misusing substances. In 2018, 1 in 5 people in the US had an STI, and STI rates have only risen significantly since that time. And $1.1 billion in direct medical costs were attributed to 3 STIs, 3 common and preventable infections. But when you look at all STIs, over $16 billion in direct medical costs a year are related to sexually transmitted infections. So today we'll be talking about bacterial and viral STIs, but there is also some parasitic STIs. So here is a list of common ones. Hopefully you've heard of chlamydia, gonorrhea, syphilis, herpes, HPV, hepatitis, HIV. But there's also things like pubic lice, or sometimes referred crabs, scabies, trichomoniasis that are common. So had mentioned STI versus STD. STI is an infection. An infection is when the bacteria or virus enters the body. A disease is generally referred to once that person is symptomatic or it becomes systemic or causing a disease, not just being in the body. They're often used synonymously though. CDC is still using the term STD, but that's more related to funding. So if you catch yourself using disease or infection, it's okay. Some people have a different preference, but more often we're hearing STI for infection because many people remain asymptomatic with these infections. Also to note, not all STIs are reportable diseases. Reportable diseases help us measure the rates at which people are getting them, know more about symptoms and other things that are happening. So I have starred the ones that are reportable in Idaho, which are chlamydia, gonorrhea, syphilis, hepatitis, and HIV. So just as not all STIs are the same, they're not spread equally. They can be spread through sexual contact of any kind. That could be vaginal, oral, rectal, through touching, direct contact with sores or infected body fluids. It may happen perinatally or from mom to baby during pregnancy or childbirth. They can be localized infections, meaning they only cause symptoms or stay within a specific area, often the point of contact where it enters the body, or they can be disseminated and systemic throughout the whole body or move to different locations in the body. Testing is often done in different ways for different infections, and we'll talk about that when we talk about each infection, but it could be blood, urine, or a swab. And these swabs or even some blood tests can be done or collected by the person themselves, not having to have a provider. Provider collect the swab, which is often a less invasive option and can be more effective. Chlamydia and gonorrhea definitely are able to have self-collected swabs, sometimes with HIV, hepatitis C, or syphilis, they can also be done via self-collection. So that's something as a patient you may be able to request with your provider, or your provider could offer. And they would offer testing to swab different locations based on different activities and different risk factors. So let's dive in to the infections. So we'll start with bacterial infections and chlamydia. Chlamydia is the most common reported STI in Idaho, and it's one of the most commonly reportable diseases. It can infect, be a genital, so vaginal, urethral infection, rectal infection, or oropharyngeal infection, which means throat. It is rare to be found in the throat. Symptoms can be discharge or bleeding, burning or pain with urination, pain and swelling at the location of the infection, but up to 75% of infections may be asymptomatic. It is diagnosed by a swab of the site or a urine specimen, and it is curable with a course of oral antibiotics. It's important because it can cause damage to the reproductive system or ectopic pregnancy, and someone that has been cured can become reinfected. This data here shown is provisional. It's 2021 data for Idaho broken down by the public health district. So there's 7 panhandle, so starting with North Idaho, moving to Eastern Idaho. You'll see just over 6,000 infections. Nationally, there was a small decrease over the last couple of years, but seeing an increase again. Next, we'll move to gonorrhea, another bacterial infection. It is similar to chlamydia in where someone can be infected, but it is more common to see throat or oropharyngeal infections with gonorrhea. It's often commonly asymptomatic, and that can mean many of these types of infections can go undetected and continue to spread. It's more common for women to be asymptomatic than men with gonorrhea. Again, tested with a swab or urine specimen and is curable with oral and injectable antibiotics. The most common treatment is an oral antibiotic and an injectable antibiotic. Can just have oral given in certain situations. Gonorrhea can also become disseminated into different spots of the body. So have seen joint infections, so like a knee infected, requiring different treatment. You can also be reinfected with gonorrhea. And just under 1,200 people in Idaho had gonorrhea or were diagnosed with gonorrhea in 2021. Gonorrhea is also increasing in Idaho and across the nation year by year. And it's something that we're closely watching because currently it's curable, as we mentioned, but they are starting to see some antibiotic resistance to common treatments for gonorrhea. Syphilis is the next bacterial infection we'll discuss. Many people have heard of syphilis throughout history, different people that have had it or even died because of it. But many people don't think of it as an infection that is currently around. There was a plan and thought that it could be eliminated in the 90s and early 2000s, but have since seen an increase and a sharp increase in cases reported in the last 5 years. So syphilis is diagnosed with a blood test, and depending on symptoms and the situation, there might also need to be a CSF or cerebral spinal fluid test, which requires a lumbar puncture, sometimes called a spinal tap. And it can be treated as well. It's treated with injectable antibiotics or IV antibiotics. Oral antibiotics are possible to use, but not considered the first line treatment. Syphilis is spread through contact. It doesn't have to just be sexual contact, but it can be contact with sores or in any area that has infectious lesions. Syphilis is also staged by the stages of symptoms, which change over time. Syphilis is systemic, so it can be throughout the body. First, the symptom that will appear is in what they call primary syphilis, and it is with the development of a sore or sores, and they're generally painless, and that's at the site that syphilis entered the body. So sometimes it's easy to see, sometimes it might be in a location that you don't realize you have it if it's more internal. That sore will heal on its own and then go away. And then the next symptoms that develop are in secondary syphilis, and it can be a skin rash, mucous membrane lesions. You can feel fatigued, fever, swollen lymph nodes, may see patchy hair loss. And an individual I worked with once, they were actually losing their eyebrows and eyelashes. So that hair loss doesn't necessarily mean just the head. Those symptoms will eventually go away, and then it goes into what they call latent syphilis, where there's no signs or symptoms, and it can potentially move into tertiary syphilis later on, and that's when the internal organs are impacted. It can affect the heart, blood vessels, brain, nervous system, and that's if the infection's left treated for many, many years. Syphilis has often been called the great imitator because symptoms can seem like other things. They can be non-specific. Testing for syphilis is also not part of everyone's general panel or the standard panel. So it may be something you want to ask for specifically or confirm that it is being tested if you could be at risk. In Idaho, we have seen an increase. We'll go through that on the next page, but we've also had clusters of cases, so not outbreaks associated with individuals using meth, IDU or non-IDU. So this is more about the rates in Idaho. Early syphilis is syphilis within the first year, and that can be primary, secondary, or even into when there's no symptoms. You'll see that in 2021, there was 148 cases in Idaho. In the first half of 2022, there's been more than 91 cases reported. So on track to be above again this year. For latent or unknown syphilis, so unable to determine if they had it for less than a year, more than a year, or we know they've had it for more than a year, was 117 cases in 2021. Syphilis is only infectious during symptoms in that early stage, so that's one reason that they're counted different or counted separately. Also in these increases, we're seeing the largest increase in cases reported in women, going from maybe 0 to a handful of cases to more and more each year of women being diagnosed. Women of childbearing age are priority for public health to follow up because of congenital syphilis. Congenital syphilis is when a baby has syphilis from mom during pregnancy. It can cause miscarriage, stillbirth, death, bone deformities, deafness, and additional complications. And there's an 80% chance of the mother passing syphilis to the unborn baby if not tested and treated. So in Idaho, we hadn't seen any cases for several years. Saw the first case again in 2018, another one in 2019, 2 in 2020, and looking like 5 in 2021. So not the trend we want to see. And The most common reason we were seeing this was due to lack of prenatal care, missed testing and treatment opportunities. It's important to be tested early, so at that first prenatal visit, and again before the third trimester, or at the beginning of the third trimester, because it can be treated, and the earlier the treatment, the better. One of the reasons nationally we're hearing about lack of prenatal care can be in women in recovery, women currently using or misusing substances due to fear and stigma with their providers and potential outcomes. So right now it's a large topic of discussion, training, and education for healthcare providers to help reduce that stigma and fear and have more women come in for prenatal care. So now we'll move into viruses. Marcielle, one of my coworkers, presented on HIV earlier this month. Great presentation, so I'll be brief, and you can refer back to his presentation for more details. HIV can be spread through blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. So it's not just sexually transmitted, but is sexually transmitted is a common way. Rates in Idaho are staying similar year to year. We would expect to see them go down because of this U equals U. If you are on medication and your viral load is undetectable, it means it's untransmissible. We don't see transmission of HIV in people that are undetectable and on medication. Idaho has really great rates for that of people we know that are living with HIV, so transmission should be going down, but we're still seeing about around the same amount of new cases every year. You'll see that in Idaho, we had 53 new diagnoses in 2021. Another thing about Idaho that's important to note is we have a lot of people diagnosed with late stage HIV stage 3, also known as AIDS. So at the later on, so we encourage testing. Testing is important for everyone once in their lifetime or more often if they're at risk. HIVs can be asymptomatic in the beginning. An acute illness could be flu-like, or later on it's often found when other infections are present. Testing can be done via a rapid test, which is a finger poke for a little bit of blood or an oral swab, and then blood testing. And mentioned treatment, there is treatment that can get to somebody to this undetectable level. It's a manageable illness. Or there's also pre and post exposure treatment. Something called PrEP can help prevent the acquisition of HIV, or something called PEP. If you've been exposed, you could start medication to prevent becoming infected with HIV. Another virus is the herpes simplex virus. It is not reportable, so I do not have any specific Idaho data on it. It is spread through saliva, genital secretions, a sore in the infected area, and it can also spread when symptoms are not present. Symptoms could be sores at the infected site, but most people are asymptomatic or only experience symptoms infrequently. It can be tested, antibodies can be tested for via blood, or a swab of a sore during an exam can be cultured. There is antiviral medication to help with treatment, and it's estimated that 1 in every 6 people could have genital herpes, or even more than half of Americans have one form of HSV, HSV1 or HSV2. You may have heard it called as oral or genital herpes. Those terms are kind of being moved away from because it was primarily where it was located, but now we're seeing infections in different areas. So oral infections being found in the genital region, things like that. So HSV1, HSV2, or just herpes. HPV, or human papillomavirus, is another virus that can be spread through sexual contact, including close physical contact. There's multiple types of HPV viruses. And in most cases, HPV will go away on its own within a couple of years without causing any health problems. But in some cases, with some of it will cause genital warts or eventually can lead to cancer. It is the most common STI with over 43 million infections recorded in 2018. 13 million of those infections were new at that time. It can be diagnosed with warts, just the visible warts on exam, or part of a routine screening such as a Pap test. There's treatment options for warts that they vary, and there is a vaccine to help prevent this. It's now a routine vaccine for adolescents age 11 or 12. It can be given as early as 9 years, and often part of a catch-up vaccine through people aged 26. If you're older than 26 and feel you could be at risk or there could be concerns, you can talk to a provider and have clinical decision-making to determine if it's recommended up to age 45 or even potentially older. So now we're going to move into infections that are not necessarily considered STDs or STIs, but can spread via sex and often do so. So on this slide, it talks about monkeypox or Mpox, MPX, which is not being considered an STI, but you'll often hear that it's sexually transmissible. So it's a little bit of semantics that's going on right now because things like syphilis and HIV are not exclusively spread during sex, but that's the primary way we see them transmit, and they're still considered are often considered in that STD, STI realm, or focused on with funding through STD, things that way. So again, a little bit of semantics, but wanting to talk about things that do spread or can spread sexually. So often that's because risks and populations overlap, whether it's in sexual networks or not, and that's what you'll most commonly see right now with monkeypox. So monkeypox is a global outbreak that we had seen monkeypox transmit or small outbreaks, but nothing like this until this year. There's over 24,000 cases in the US at this time. The data suggesting that gay, bisexual, and other men who have sex with men make up a majority of the cases in the outbreak. However, it could spread to anyone that's been in close contact or personal contact with someone with monkeypox. Again, it spreads through that close skin-to-skin contact and prolonged skin-to-skin contact. So sexual contact is close, prolonged skin-to-skin contact, therefore a good mechanism for it to spread. It can also spread from touching contaminated objects, so objects that have the virus on it from that individual. So mention of things like towels and bedding, but also sex toys and gear. So it can also spread through respiratory secretions, so kissing, cuddling when you're close face to face. And they are learning more about if it can be spread through other bodily fluids such as semen. There is a vaccine which offers protection to those at risk and other prevention methods. So other sexually transmissible infections can include Shigella and other enteric diseases. Enteric diseases are intestinal illnesses, and generally people are infected from food or water that are contaminated, but can spread person to person through a fecal oral route, poop to mouth. So contact with anything contaminated. It can spread through certain practices, toys, and Shigella is listed because it's bacteria that can spread really easy. Just a small amount can cause infection. We've seen multiple outbreaks in many different cities. And when I was working as an epidemiologist, I had talked to several people that the likely source was during sexual activity with a partner. As you can see, CDC has also created a bunch of graphics and posters specifically from Shigella outbreaks that have happened. Hepatitis A, B, and C are also infections that can spread via sex. Danae did a great presentation on hepatitis. So for more details, please refer back to that presentation. Hepatitis A is an acute infection, and we don't normally see reinfection. It is transmitted similar to enteric illnesses, and there's been outbreaks within sexual networks. Hepatitis B is a chronic infection that can be transmitted through sex and bodily fluids, blood, or through at birth. Unvaccinated adults who have multiple sex partners, along with sex with people with chronic Hep B, are at increased risk for transmission. There's also increased risk of transmission for people with injectable drug use for transmission. And so STI clinics have been a place where they've encouraged Hep B vaccine. There is a vaccine for hepatitis A and hepatitis B, something to speak with your provider about if not vaccinated for those. Hepatitis C does not have a vaccine, but there is a treatment available, and it's recommended that all adults get tested for hepatitis C. Hepatitis C can be transmitted through sexual activity, but it's not its most common mode of transmission. Some of the risks for hepatitis C are having a sexually transmitted infection, having sex with multiple partners, engaging in anal sex also increase the risk for hepatitis C. So we'll talk about some additional ways to prevent STIs and resources for people with STIs. So abstinence from sexual activity is an option, but we know that doesn't work. It's not going to be the best way to prevent. That's not going to work for everyone. So there is also use of condoms, dental dams, and other protective barriers. Those also do not work for all transmission modes, that skin-to-skin contact, and they're not 100%. So other ways include knowing your status and the status of your partner. Get tested, set up a testing schedule, talk to your partner, being in a mutually monogamous relationship with a partner whose status you know, reducing the number of sexual partners you have, limiting factors that may lead to behaviors that could increase your risk or change your inhibitions. But really remember, talk, test, treat. Talk openly and honestly with your partners and your healthcare provider. Get tested. It's the only way to know for sure. And then you can also receive treatment or prophylaxis, other prevention methods. If you do test positive, work with your healthcare provider to get treatment, or if you've been exposed, there may be treatment options. Treatment options can include expedited partner therapy, which is the treating of sex partners of patients diagnosed with certain STIs, generally chlamydia and gonorrhea. And the healthcare provider can provide a prescription or medication for the patient to take to his or her partners without that healthcare provider examining the patient. It's considered effective and shown that patients whose partners received EPT were 30% less likely to be reinfected than those who simply told their partners to visit a doctor. It's a practice that's been recommended and supported by the American Academy of Family Physicians, It's also been supported by the American Bar Association to support led to support reducing legal barriers. We have spoken to our Board of Pharmacy, and it is approved. It's also legal or considered permissible in almost all 50 states. You'll see 4 states listed on this map where it's potentially allowable. So in those states, you'd want to look into the laws a little bit more. We do have a guide for clinicians in Idaho about EPT in Idaho if interested. Some Idaho resources for individuals. So talking about testing, findidahotesting.com shows resources for how to get free condoms, seek different types of testing and prophylaxis. It now includes monkeypox services as well. Takemehome.org is a site where you can get a free at-home HIV test. Let'sGetChecked.com is also a source to get free STI testing. So can include chlamydia or gonorrhea, which would be a urine test. Can do hepatitis C, syphilis, and HIV, which are finger stick, an at-home finger stick, getting a little bit of blood and sending it back. And then we also have prepmeidaho.com, which is a way to find HIV prep materials, info, and providers that prescribe it. So if you're looking for different types of options, you may not have a provider you're comfortable with, a patient may not have access to a provider, here's some resources for them. And as a patient, not all medical checkups include STI testing. So make sure you're talking with your provider. If you don't have a provider, you can locate one potentially on Find Idaho Testing. But don't be scared to bring this up when talking with a healthcare provider. And then another element is partner services and disease intervention specialists. So DIS is a disease intervention specialist, and they're often the ones doing partner services. It's an array of services offered to individuals with an STI or HIV and their partners. It is a process that involves being able to confidentially and anonymously notify people that have been exposed or could be infected. DIS interview a person and then help them link them to care and resources and their partners to care and resources. It's client-centered, confidential, voluntary and non-coercive, free, evidence-based, culturally and developmentally appropriate and accessible and available to all. And it's also comprehensive and integrated. In Idaho, it is done by the public health districts. There's a map here of the different public health districts that could be in your area. And instead of a DIS, it might be a nurse or an epidemiologist. It is a growing field and was really hit on more when COVID contact tracing happened. So DIS have been doing that type of contact tracing around STIs, HIV, and other infections for a long time. My role now is to help build that capacity and support DIS and DIS work in Idaho. It's something I'm really passionate about and find really valuable and impactful. So it is something that is happening in Idaho and growing in Idaho. It is recommended that everyone with HIV and syphilis receive partner services with that health department involvement. And then just due to resource constraints, gonorrhea and chlamydia infections could receive partner services with health department support, but may not. So it's important to know that if you don't receive a phone call or a patient may not receive a phone call, they could reach out to their health department Or there's also some anonymous online notification or notification tips out there, things like tellyourpartners.org. This is a graph that just kind of shows how it works. Somebody goes in for testing, that report's received, they're offered partner services, they decide they don't want to notify their contacts or partners, or they do it on their own, and how it just kind of continues to be a feedback cycle. Thank you for listening today. I just want you all to remember that sexual health is part of health and your overall health and well-being, and including individuals in recovery. It encompasses more than just infectious diseases, but infections are common. They're preventable, curable, and manageable. So now I'll take any questions. It's a safe space to ask questions, nothing weird, scary, stupid, anything like that. So please, please throw anything out there you might want to ask. You've never asked, you don't know. Or feel free to reach out to me for any additional questions, info, or resources at my email listed here.
Hi, Lindsay. So I'm monitoring the chat and we do have a question. How often should somebody get tested for STIs?
That's a great question. It is based upon potential risk. So if you've never been screened, but have been sexually active or had that close, intimate contact, I'd recommend screening. If you're having multiple sex partners, or you don't know, you're not in a monogamous relationship, your partner might have outside partners, you may want to test more frequently. For individuals, say, that are on HIV PrEP, they're often tested every 3 months is a good interval. Some people prefer 6 months or annually.
Oh, great, thank you. I do have another question as well in the chat. So with the gonorrhea, you mentioned that there's different treatments and you're really watching that closely for Idaho. My question that I have here is that due to like a superbug type thing? So, you know, in the past when people take antibiotics, they tell them, you know, finish the entire medication to make sure we prevent from having superbugs and such. Is that kind of a similar situation with gonorrhea?
It can be similar. Gonorrhea is just a really tricky bacteria that has learned over the years how to keep going regardless of antibiotics. So there's potentially antibiotic resistant versions out there. We're not seeing tons in the US or tons in Idaho where we're seeing people unable to be treated, but we're watching it so that doesn't happen. It is important to take your full course of antibiotics, take as directed. And if you're still having symptoms after an infection, say of gonorrhea, it's important to talk to your healthcare provider to see if a different treatment could be needed.
Okay, well, thank you for that. We do have another question here, and that is for HPV vaccination. Is that for, not that we want to get into like the gender thing, but can boys and girls get that vaccine?
Yes, that vaccine is for everyone.
Yeah, thank you for that, for sharing that. And then you did mention in that presentation that adults can still speak to their providers. So if you're an older adult in your 30s or your 40s, it would just be something that you would talk to your provider about if you decided you wanted to get that vaccine.
Yes, it was initially thought most people would have already been exposed to HPV at that point in their lives. But they're finding now that people have all different risks and behaviors, and they may not have been exposed or may now be exposed at different points in life, and it's still valuable to have that protection. So it's really going to be a discussion with the patient and their healthcare provider, and that's why it's not a general recommendation at those older ages.
Okay. Well, thank you for that. Oh, here's another question. Does the locator provide information on HCV treatment providers? And yes, it does.
I'm gonna say, Danae, you're the expert. I'd let you answer that.
Yes, that's a great question. Thank you for asking that. It does. It's an amazing resource. I love that resource because, you know, even if somebody is specifically looking, say they wanted just for HCV testing to find out where they're at or what providers, when they go there to the service locator page, it's great because there's more besides that they can find. So they can find providers for STD, they can find information for HIV, our safer syringe program. So I love that locator page.
And I find myself using it too, just to help find resources to refer people to. So I look at it all the time.
Yeah. Oh, thank you, Randy, for putting in there, findidahotesting.com. Yes, that's so much easier now to just, for people to just Google that, findidahotesting.com, and it comes up as well. So thank you.
Lindsay, this is Randy. I have a question for you. Could you speak a little bit more to what's going on with monkeypox in Idaho and you know, response of public health to try to address the spread of monkeypox?
Yes, great question. Currently, Idaho has 12 reported infections of individuals with monkeypox. 11 of those are within the Treasure Valley area. We haven't had a new case reported, knock on wood, in the last few weeks, which we've kind of seen nationally the trend going down. However, all of the public health districts are working and prepared to respond if needed. Contact tracing is happening, so those individuals that did test positive are receiving an interview to learn more about their situation and also who may have been exposed. The contacts that have been exposed are also being notified, offering vaccine as prophylaxis and additional information. There is treatment for monkeypox, so generally was thought of as not severe and not cause. There's been one death in the US, so we don't see it cause severe illness causing death, but there has been hospitalizations and a lot of pain associated with the rash and the lesions, and so there is treatment to help with that. And then for prevention, if you're potentially in one of the risk categories, so having multiple partners, having been exposed, things like that, you may qualify to be vaccinated because there's only a limited number of vaccines right now. The public health districts have those vaccines along with some healthcare providers. Those healthcare providers and health department info can be found on that findidahotesting.com.
Awesome, thank you. What other questions do you all have? Feel free to unmute or type that into the chat. Okay, hearing no additional questions, we'll go ahead and wrap it up for today. So again, thank you everybody for joining us to learn a little bit more about sexual health and recovery. And thank you so much, Lindsay, for that really comprehensive presentation. Lots of infections to think about. but really like easy prevention messages. So thank you for that. And I just wanted to remind you all that there's a recording and slides from today's session on the Northwest ATTC website. And for those of you that attended the session live today, you'll receive a survey requesting your feedback and a certificate that can be used for continuing education credits. And certainly encourage you all to join us for part 6 tomorrow, where we'll talk about harm reduction. And that's tomorrow, Thursday, September 22nd at noon Mountain Time. So, and you can register on the Northwest ATTC website to attend that session. But thank you all so much. I wish you a wonderful Wednesday.
Thank you, everyone. Thank you, Lindsay and Randy. It was a great presentation.
Thanks, everyone. Have a wonderful day.